Can everyone hear me? Yes, I hear myself really well, so I'm sure you can all hear me. Welcome, everyone. My name is Matt Wynia. I direct the Center for Bioethics and Humanities. That's the building you are in. This is called the Fulginiti Pavilion for Bioethics and Humanities. It is a remarkable thing to have a center like ours on a medical campus with an art gallery and a performance space like this one, a theater in the round. We're very proud of the space, and we're very proud to be the opening event for Flourishing Through the Arts and Science, part of Denver Art Week, which it turns out is a little more than a week. It's more like a week and 2.5 days. So welcome to the beginning of Denver Arts Week and to the Fulginiti Pavilion. And I am going to turn things over to Shannon Robinson to really do the introductions. But I was given 2 minutes, so this will be very short. But I just have one thing I have to get off my chest. Well, 2 things I have to get off my chest. One is the staff of the Center for Bioethics and Humanities have just been incredible in pulling together to make this happen today. So I want to thank Danielle Chait. I want to thank Malia Himber. I want to thank Joe Virden. I want to thank Lori Monroe. Some of those people are in the room, not all. Thank you, Lori, for all the work that they did, both in the long term and just in the last few days to make this happen. The other thing I want to get off my chest is that we are on a medical campus, and we're talking today about arts and health. And it is really tempting for those of us in healthcare and medicine and science to be very instrumental in the way we think about everything. We want to know, what is the outcome? And how does this activity lead to that outcome? And I think that is really important, and it's an important thing for people to know who are supporters of arts in the health sciences environment. I also think it's important for us to acknowledge at the outset that we don't do art to achieve an outcome. We do art because that's what it means to be human. And this whole endeavor is at risk, I think, of sometimes losing sight of that, because it is very focused on what are the health impacts of arts-based interventions and of how do you use the arts. And again, I don't want to denigrate that. That is really important, and I want us to spend time on that. I want us to understand that. I just don't want to lose sight of what the arts mean to us as a species. Because it's not always about the outcomes. Not everything we do in life is instrumental. Some of what we do is because that's what it means to be us. So with that, I'm going to turn things to Shannon Robinson, and I do have an introduction for Shannon. Shannon is a retired attorney and an arts advocate, collector, and the president of Windows to the Divine and Collectors for Connoisseurship, a nonprofit foundation that promotes the importance of human flourishing, interfaith dialogue, philanthropy, and the special calling of artists. Through exhibitions, symposia, and salons hosted in collaboration with museums, galleries, and other nonprofits, her foundation encourages everyone to engage in and support the arts. This goes on more, but I want to turn things to Shannon so that we can get to our panel discussion. Suffice to say, Shannon is an incredible supporter of the arts and an incredible thinker about the arts, and I turn the podium to Shannon.
Thank you, Dr. Wynia, and thank you to the CU Bioethics Center for sponsoring our national speaker, Dr. Edwards, from whom you'll hear in a minute, and for partnering with us on what I truly believe is a momentous turning point in human history. And I say that because we really are standing on the verge of a growing worldwide movement that now recognizes the crucial role and relevance of the arts to every human being, no matter who they are or where they live. And as a result of credible scientific research being conducted and published by academia, and also multidisciplinary research to practice initiatives such as the groundbreaking NeuroArts Blueprint, which you'll hear about particularly from Dr. Edwards. That NeuroArts Blueprint is being led by the International Arts and Mind Lab at Johns Hopkins and Aspen Institute. Because of their efforts, we are really witnessing an extraordinary convergence of disciplines. And it's going to result in a game-changing partnership between the arts and sciences that's really nothing short of revolutionary. This is really, really big. With advances in medical technology, we now know more about the human brain and its responses to art and aesthetic experiences than ever before. And we can and should educate the public about why and how they should engage in the arts to flourish physically, mentally, socially, and spiritually. This rapidly developing field of neuroaesthetics is now poised to influence not only how we prevent and treat disease, but why the arts with their differing modalities should be employed in every space, every audience, sector, and environment. Not just hospitals and healthcare facilities, but schools, corporations, government, private, and public spaces. Because we can demonstrate that art, like exercise and diet, is essential to human health and well-being, it's time to recognize the importance of integrating the arts into all aspects of human life, a mission of profound significance that will impact generations to come. And today, we're fortunate to have three particularly qualified speakers to address this evolving field and its potential impacts for all of us. Each of them will give a short presentation about their work. And since we have a lot of ground to cover, if you would please save your questions for the Q&A later, that would be great. Our first speaker, I will introduce her. It's Dr. Emmeline Edwards. She is the Director of Research for the NeuroArts Blueprint, which I mentioned before. It's one of the leading neuroaesthetics initiatives in the country. Dr. Edwards earned her PhD in neurochemistry from Fordham University, and she did her postdoc research in behavioral pharmacology and neuroscience at the State University of New York at Stony Brook. She also was a tenured associate professor in the Department of Pharmacology at the University of Maryland. Dr. Edwards also served on the Sound Health Executive Committee for the Sound Health Network. She's a member of the Trans NIH Music and Health Working Group, and she's an advisor to the NeuroArt Blueprint. Importantly, Dr. Edwards also chairs World Women in Neuroscience, a mentoring and networking organization dedicated to promoting professional development of women neuroscientists across the globe. And we're fortunate today to have a short video introducing her further and introducing you to the NeuroArts Blueprint. You will hear from one of the pioneers in this field. Her name is Susan Magsamen. She's Executive Director of the International Arts and Mind Lab at Johns Hopkins, and she's also co-director of the NeuroArts Blueprint. Significantly, Ms. Magsamen is also one of the co-authors of the New York Times bestseller book. I hope you all get it and read it because it is amazing. It's called Your Brain on Art, How the Arts Transform Us. It was the foundation of the layperson introductory guide to research regarding flourishing through the arts, which you see up on the screen, and that's the QR code so you can access it. It's a free guide, and basically our foundation created it for arts organizations and the public to kind of simplify it. It goes through the research by modality, and so I welcome you to not only see it, but share it widely. It's free, non-commercial purpose to it. Dr. Edwards will be followed by Dr. Moss, who's the Roger S. Mitchell, as of today, Distinguished Professor of Medicine. Yay, congratulations. In the Division of Pulmonary Sciences and Critical Care Medicine at the University of Colorado School of Medicine. Dr. Moss has a long-standing interest in critical care-related research, and he has held continuous NIH funding as a principal investigator for over 25 consecutive years. More specifically, Dr. Moss's research interests include identifying new treatment modalities for patients with the acute respiratory distress syndrome. Particularly significant for us today, though, is his research and work with the Colorado Resiliency Art Lab, which studies burnout syndrome, post-traumatic stress disorder, and wellness in our healthcare professionals. CORAL is a multidisciplinary group of researchers, doctors, artists, and therapists who are harnessing the power of creative arts to promote the psychological wellness of healthcare professionals. So for all of you medical folks out there, again, we salute you, and we hope that that is of great service to you. His research on wellness was initially funded by the NIH and is currently funded by the National Endowment of the Arts. And our last speaker, Don Ruggles, brings an important perspective on the significance of flourishing research on the architecture of our public and private spaces. Don is CEO Emeritus of Ruggles Lindemann Bell Architecture and Interior Design Denver. He's also the author of a must-read book, Beauty, Neuroscience, and Architecture, and producer of Built Beautiful. Don serves as Director of Classical Studies at CU Denver College of Architecture and Planning. Significantly for our program today, he co-founded the Design Health Initiative, which I'm sure he'll tell you more about, and he sits on many design and health boards. And now I'll turn the program over to Dr. Edwards.
Thank you very much for having me. It's been my first time in Denver, so I'm really pleased to be here. And I'm going to let Susan McSalmon give you a little taste about what the NeuroArts Blueprint is.
Hello, I'm Susan McSalmon, Executive Director of the Johns Hopkins International Arts and Mind Lab Center for Applied Neuroaesthetics. And I'm also the co-author of the book, Your Brain on Art, How the Arts Transform Us. I'm proud to serve as the co-director of the NeuroArts Blueprint Initiative. Our mission is to cultivate an ecosystem for NeuroArts, which we define as transdisciplinary and interdisciplinary study of how the arts and aesthetic experiences measurably change our brains, body, and behavior, and how this knowledge is translated into specific practices that advance health and well-being. The Blueprints Initiative is a partnership between the Aspen Institute's Health, Medicine, and Society program and the IM Lab. Together with collaborators from around the world, we are building a community of researchers, artists, arts practitioners, community knowledge keepers, and other allies who understand the imperative of using art as a science-based tool to advance our collective health and well-being. I'm excited to introduce Dr. Emmeline Edwards, the NeuroArts Blueprint Research Director. She provides leadership and strategic direction to the initiative's research efforts by developing and guiding the Blueprint research strategy, managing signature research-related programs, and supporting and guiding the growth and stability of the field of NeuroArts through evidence-based research and related efforts. Dr. Edwards recently retired from federal service as the director of the Division of Intramural Research of the National Center for Complementary and Integrative Health. In that capacity, she was responsible for planning, developing, and implementing all scientific programs in areas of science that fulfill the NCCIH's mission. She led the development and release of the NIH Music-Based Intervention Toolkit and is a member of the interdisciplinary expert panel who updated and released the music-based reporting guidelines. I am thrilled that Dr. Edwards can be with you today.
Because it's a ethics deal.
Thank you.
I know it's not working. Like, I just don't want to do it.
As Susan McSalmon just mentioned, the NeuroArts Blueprint is developing a global research strategy. The goal is to actually establish standards and best practices for anyone conducting research on the art in collaboration with other sectors such as health, public health, education, business, architecture and design, and community development. It's a very ambitious goal, and we are mapping out our activities by 5-year chunks. So in the first 5 years, we have identified a number of high-priority clinical and translational research topics: mental health intervention, neurodegeneration and healthy aging, rehabilitation approaches, social engagement, and intentional spaces. They in the limited time that I have, I'm only going to give you two examples of two of the areas. So one example is really how researchers are actually using music engagement for the management of patients that have Alzheimer's disease and related. One of the symptoms of fear dementia is really to have aggressiveness and violent behaviors. And typically, standard of care is that these patients are receiving diazepam to calm them down. And we have been studying whether music engagement could actually help with those symptoms. And this is an example of a study which is actually quite a large study, because typically, and this is one of the problems that I'll mention later, is that the studies that are currently ongoing are usually small, but this one actually was carried out in 54 nursing homes, and the intervention was delivered to 483 patients with either moderate or severe Alzheimer's. And the control experiment, those patients receive care, which is typically polypharmacy, primarily with benzodiazepine. And what you can see here is that this is the adjusted proportion of people that have those verbal behaviors that are very disruptive, not only to the other patient, but also to the caregivers. And essentially, a personalized music intervention was delivered to those individuals, and they were able to monitor the level or the frequency of aggressive behaviors. And those behaviors include screaming, singing, laughing out of control, really being aggressive to the other patients. And the intervention actually, there was an increase in the proportion of the proportion of behavior of not showing this kind of aggressive behavior. And in certain groups that actually were demonstrating 1 to 3 episodes, the intervention actually decreased that sort of behavior. So essentially, the music engagement is not actually addressing the core symptoms of Alzheimer's or related dementia. It's really symptom management of certain behaviors that are very. So the second point that I want to make is that you are not only in engaging into the potential of improving the quality of life of these people, but there's also an economic impact. The NeuroArts Blueprint has conducted two recent economic analysis. The first one actually focused on the economic aspect of it, showing that it increases the potential of having jobs in the US and generated labor income, but it also increased quality of life for the patients. Second example that I'll have actually is related to the fact that where we live can actually influence our well-being and our physiological outcome. So this is an example of a building in Montreal where elements of nature have been incorporated into this building. And the researcher that's doing this experiment is Cleo Valentine in the UK. And she's actually using EEG, quantitative EEG, to look at the oscillation patterns of the brain to people that have been exposed to images of buildings that are called biophilic building, like the example that I showed, as compared to a regular, like high-riser. And essentially what she's finding is that there are differences in the delta band, which is a proxy for a neuroinflammatory marker. And essentially, by exposure to this kind of patterns, you can actually decrease your stress and potentially decrease neuroinflammation. Now, I caution you that this is a very small study. There's only 10 subjects in this study, but the data is is tantalizing, and definitely Dr. Valentine intend to actually do much larger samples. Those were my two examples, and I'll cover more during the conversation. So I'm going to turn it over to Dr. Moss from the University of Colorado. Thank you.
Thank you, Dr. Edwards. That was very interesting work. So I'm a pulmonary critical care doctor. So I take care of people on life support systems. And as I explained during the pandemic, I was the one working the intensive care units with a whole team, taking care of COVID patients that were on ventilators on life support systems. So I want to start off by saying I love my job. I can't imagine doing anything else. I find it incredibly rewarding. People are very sick. They're often sedated. They're often not aware of what's going on. You come in, you get them better, and in sort of an anonymous way. Sometimes people come back to the ICU to, as they should, to thank the nurses, and they'll go, "Who's that guy?" And they're like, "Oh, he was one of the doctors taking care of you." And I kind of like being sort of behind the scenes there. I just want to emphasize that I really love my job. Though there are difficult components to it. We deal with a lot of tragedy in the intensive care unit. We deal with a lot of sick patients, families going through the most stressful time of their life. They're afraid that their husband or wife of 40 years is going to pass away. And they don't know who you are. They don't get to pick you as a doctor. You have to build the trust with them immediately. And you can screw it up pretty badly, but you can make a huge difference in the patient's life and in the how their family deals with this difficult situation. So that's a little bit of background of who I am. I can tell you through all our training, we're not exposed to any of that. It's sort of, at least we didn't used to be, sort of what I would call a military viewpoint. You roll up your sleeves, you do your job, and if something bad happens, you just keep going. And you never talked about any of these issues. But they were very evident to me, and the story I will tell, I can tell a lot of different stories, but the one that I usually tell in this situation is, so it happened a few years ago. I was attending in the intensive care unit and had a big team. And this was around the time when people were interested in that residents and fellows and trainees were working too long. So there was this pressure to get people out of the hospital, to get them home because they'd been there for 30 hours in a row, or et cetera. And it's the right thing to do. But you're also trying to take care of patients. So we're a big team. You have medical students and residents and fellows and pharmacists and physical therapists and nurses, et cetera. And you're trying to run all this and, most importantly, take care of the patient. So we're taking care of a patient, we'll say it's Mr. Smith, and we're talking about his kidney failure. And what happened is 3 rooms over, a patient had a cardiac arrest. So we had to stop, go and try to resuscitate this patient. That's all I have for this? Oh, okay. I wouldn't have told the story, but I think it's a good story. I think it will frame the whole thing, and I can finish it in a minute. So we go to try to resuscitate this other patient, and unfortunately he passes away, and we can't. So I think I'm doing the right thing, and I say, okay, in the interest of time, how about if a few of you stay with the patient who just passed away, start to fill out the paperwork, start to, call the family and do all that stuff. And we're going to continue to work on seeing the patient. So I go back and we're standing outside of a patient's room, and I say, okay, well, let's pick up where we were about the kidney failure. And I look up and there's a 4th-year medical student doing a sub-internship, and she's crying. I say, and again, for Matt knows me, other people, I think I'm a nice guy. Okay. I think I have compassion and empathy. Some people might disagree, but I don't think so. But I turn to the medical student and say, "Are you okay?" And she says, "Yes, I'm okay." And then I say, "Well, what's wrong?" And she goes, "It's sad." I said, "What's sad?" And she said, "Mr. Smith just died." And it just put things in perspective. Like, what's happened? Like, how did I'd already moved on. So as an introduction to what we're talking about, that's the issue. What we'll do in the question and answer part of it is try to explain what we've done with the Colorado Resiliency Arts Lab to try to address this stress in healthcare professionals.
Yeah, that's fine.
Hi, I'm Steph.
We'll show that later. So Don Ruggles is the next speaker.
Thank you. Honored to be here and honored to be presenting. Remarkable panelist. I'm a practicing architect. I retired ago, and I've been, last 20 years, I've been dedicating myself to connecting neuroscience with architecture. Happened onto that subject when I gave a talk out over at Children's Hospital a few years ago, and up to that talk, I started to uncover that neuroscience actually does inform architecture pretty significantly. So the title of the presentation today is Beauty in the Built Environment, Leveraging Human Biology for Aesthetic Well-Being. And this is an encapsulation of a chapter that I co-authored with Natalie Ricci, handbook for the built environment. And it was just published by Routledge Publications. So the intricate relationship between beauty, design harmony, and biological responses plays a crucial role in shaping aesthetic preference and promoting our overall health. By examining the neurological and physiological mechanisms underlying these interactions, we can uncover how design choices directly influence our well-being, offering a pathway to environments that not only enhance health, but actively prevent disease. At the most fundamental level, humankind is genetically predisposed to seek two things: survival and pleasure. Every day, our bodies process billions of actions without us even being slightly aware of it. And all of them are geared towards these two goals. An amazing 95% of all actions processed by our brains are intuitive and subconscious, and all are geared through survival and pleasure. Well, here I'm going to show you 4 examples of how our brains process patterns, and we put them into categories because we're processing so much information that our brains, in order to operate efficiently, have to combine information into certain patterns, and that allows it to be stored more efficiently. So here's an image of a pleasure response pattern, awe-inspiring and beautiful, and there's nothing here that registers as a threat. It invites us to relax, to pause, even to approach. Your nervous system, which again is below conscious awareness, your nervous system registers this as rest and relaxation pattern. Incidentally, this image is produced by a local emerging artist, Abby Wolf, and I think Abby is here today attending. Okay, conversely, here's a survival pattern. Our nervous system knows that this is dangerous and it will take action to avoid this. Elevated heart rate and increased levels of stress are resulting of a scene or a pattern such as this. This is known as fight or flight or freeze reaction. Well, here's another expression of pleasure and approach. This is set in a biophilic scene. It's composed of uniform geometry, built from natural materials and graced with a layer of snow. This scene engenders a sense of relief and acceptance. We approach easily and without fear. Here's an architectural image that is overwhelmingly survival and avoidance pattern, yet it contains some pleasure approach geometry. So notice how the survival pattern of the new construction overwhelms the pleasure pattern of the original building as your subconscious struggles to reconcile and make sense of these forms. The geometry types here are discordant and conflicting, and as a result, our brain is stressed to place these patterns into categories that it has been tuned to know. This is neurologically inefficient and stressful. So normally a pattern such as this would be an approach pattern, a pleasure pattern. Food and wine and cheese on a table next to a calm body of water is definitely an approach pleasure pattern. However, it's dominated by the lightning in the background. Survival pattern is clearly overtaking the pleasure pattern in this scene. Well, the purpose of showing these last two slides is to show you how the survival pattern overwhelms the pleasure pattern. Neuroscientists theorize that the processing of survival patterns is actually 5 to 7 times stronger than pleasure patterns. And why is that? Because our brains operate to protect us first and foremost, and that's how we evolved. Okay, so this brings me to the next step in aligning our neurological processing with survival and pleasure. I've been discussing subconscious neurological processing, and the brain has to have inputs to process, and those are provided by our nervous system. And because the discussion is dealing with subconscious processing, then it's the autonomic nervous system that we're dealing with. And the autonomic nervous system is made up of 2 very important and inseparable streams of information, those being sympathetic and parasympathetic inputs. And these streams of information directly affect our health and sense of well-being, both positively and negatively. So regarding sympathetic inputs, which aligns with survival, it's known as fight or flight or freeze reaction. The major characteristics of a sympathetic event are stress and anxiety. Well, this type of event initiates raised heart rate, elevated blood pressure, and narrows your mental focus. So sympathetic inputs not only make us feel ill, they are a downward pull on our general health and sense of well-being. Now, regarding parasympathetic inputs, which aligns with beauty and pleasure, it's known as rest and relaxation. Major characteristics of a parasympathetic input are calming, stress relieving, and feeling a sense of well-being. This type of event initiates lower heart rate, lower blood pressure, optimizes critical functions in immunity, which is really important for combating inflammation, and also cell repair, which is equally important. It also expands your mental focus and creates a sense of well-being. So parasympathetic inputs not only make us feel good, they boost the general state of our health. So to summarize, in the silent dialogue between our biology and the spaces we inhabit lies the blueprint for well-being or decline. The environments we create are not mere backdrops to our lives. They are active participants in the narrative of our health. Poorly designed spaces, devoid of natural harmony and evolutionary references, amplify stress and erode the delicate balance that sustains us. And conversely, environments that resonate with our biological rhythms and our evolutionary history offer more than comfort. They serve as essential allies in the pursuit of health, subtly orchestrating the physiological harmony necessary for resiliency recovery. So, as we look ahead now, the imperative is clear: design must evolve beyond aesthetics to become a crucial mediator of human health. So I'll close by saying, and this applies directly to the artist here, when someone says your work is beautiful, you should take a moment to reflect on the fact that you are improving their health and well-being at that very moment. Harmony and beauty do matter to our lives, and neuroscience has opened the door for us to step through again. Let us take advantage of it to make the world a better and a happier place. Thank you so much. Now I'll turn this back to Shannon, I believe.
Thank you, Don. That's fascinating. My first question today is directed to Dr. Edwards. What are some promising research areas highlighted in the NeuroArts Blueprint research strategy?
I had mentioned that we had about 5 areas. I'll expand a little bit on mental health interventions. And an example that I'll describe is the work that's being done at the VA with active military and also veterans. And this is one that actually utilizing the tool of mask making to allow those individuals that have PTSD to really explore, their emotions and really explore also the memories that are, recurring and preventing them from moving forward. And that work has been absolutely amazing. If you go to, some of the VAs, you'll notice that those individuals agree to have those masks displayed. And it's amazing to see the emotion that's pouring right out of those masks. And so that's one way that they feel that they can actually regain a sense of purpose, regain some control over their life. And so that's an example of a mental health intervention that's using the actual making of the mask to represent their emotion. Another example has to do with Parkinson's disease. There's been a lot of talk about using dance to improve gait of Parkinson's patients. And in New York, David Leventhal, which is a very famous dancer, has put together an amazing set of programs for Parkinson's patients. And that actually is gaining traction to the point where sometimes neurologists are actually recommending those patients to actually take those classes. And during COVID, an added benefit was the fact that you don't even have to go to a studio anymore because they were able to do this virtually. So that has expanded globally. So those are 2 examples in the context of mental health intervention and neurodegeneration.
As a follow-up, let's look at the other side of it. What are some of the challenges in the arts and health field that impede integration into our healthcare systems?
So the biggest challenge is really, there's a lot of work being done. It's almost like the train has left the station without really having a good understanding of the framework that's needed. So there's a lot of work out there, but they are very small studies and they're not well described. So it's very hard to replicate. So one of the approach that was used as the NIH was to develop, as Susan McSalmon mentioned, this NIH music-based intervention toolkit as an example that could be replicated in other art form. And what we did with this toolkit to develop it, we had brought together neuroscientists, researchers that are expert in developing behavioral intervention, people that have expertise in developing clinical trials. We had patients, we had art advocacy groups, and we worked together for a whole year trying to determine what are the common data elements that need to be included in any music-based intervention. So then we developed this resource base for the researchers so that they have a sense of what they need to include. So have a framework. What are some of the mechanisms that you're trying to impact when you're designing your intervention? What is the actual intervention? Why did you choose that? What's the research question? And the whole, the toolkit actually provide a guide. It's not prescriptive. It's really, this is what, could make your study, reproducible and actually conforming with the NIH policy of rigor and reproducibility. And so that's what we want to expand this toolkit, which is music-based, to other art forms. And this year, we actually extended this. So the toolkit is, encouraging investigators of how to know how to design their study. And we actually extended that to the reporting guideline, which is really to improve the transparency and how to actually report the outcome of your study in the literature. So we have a whole set of a checklist of items that needs to be included in any publication that's going to be in the extant literature. And the hope is that with uptake of both the toolkit and the reporting guideline, that we will actually improve the quality of the research that's out.
I'd like to ask Dr. Moss, but first I have to say, before I met you and learned about the fabulous choral program, I am sorry to say that I never thought about the issue of burnout, stress, trauma for our heroic healthcare providers. We're always talking about the patient and all the rest of us in the community, but it dawned on me in hearing your story, oh my gosh, you're facing life and death and all this. So what I wanted to ask you is, why is there an epidemic of burnout and other forms of psychological distress in our healthcare providers?
Yeah, it's a great question. I think it was always there, Shannon. I think people didn't feel comfortable talking about it. So you can go back to things that Walt Whitman wrote about, who was a nurse in the Civil War. And he had nightmares seeing limbs with maggots on it and people missing their arms and legs, crying out in the hospital. So I think it was always there. I don't think it wasn't a safe space to talk about these issues. I think medicine has changed a little bit. And when you think about what burnout is, it's that you thought the job was this, but when you start doing the job, it's that. And I think medicine has evolved in a way where there's a lot more documentation. And as I said, I didn't go to medical school to sit in front of a computer and write notes for 4 hours. So I think part of it was always there, and then part of it, there have been changes in the way it's practiced.
As a follow-up to that also, would you just talk about creative arts therapy and kind of explain why it might be beneficial for healthcare providers?
Yeah. So if the person back there, we do have a video. So if you want to start getting that up. So as the video will show, art is the medium or the vehicle to help get the expressions and the emotions out there, because some of these things are hard to talk about. And art offers a nonverbal, safe environment to get the issues out there so that people can talk about it. But Stephanie, who's a child life specialist, can explain it a lot better than I can.
Stephanie, and I am a certified child life specialist. The thing I love most about my job is the fact that this is really the perfect blend of what I wanted. I wanted to be in healthcare, but I didn't have to do those invasive procedures, and I could help children understand their experience and really master it. But my job is really hard. I have had to explain to kids when they're gonna die, and that's not easy.
I'm Catherine, and I am an art therapist. It's taxing emotionally on our healthcare professionals to be there every day for these kids when your heart is breaking. And what do we do with the pain, with the trauma, with the sadness? And what we've found is that bringing creative arts therapy into the room, there is a natural healing element that is a wonderful thing.
As As a child life specialist, I use play as a way to educate children, to help them feel that this environment that they're in, the hospital, the clinical setting, is normal. And I think art really translates that for healthcare professionals, because sometimes it can be really hard to verbalize the frustration or the sadness or the grief that you're feeling. Having that task that everyone is doing puts us all in this normal, calm space, and then we can reflect on what we've done and go even deeper. And I think that's where that therapeutic level comes in. It's the combination of that facilitator and the group discussion.
What is happening across the country is that healthcare professionals are getting exhausted. We are often asked to do more than what is emotionally healthy for us. We don't really expect our healthcare professionals to admit that they are sad or to admit that they are tired even. Choral is a potential answer to that problem. To have a place where those truths can come out and can be explored and processed and then shared with other people, I think is an incredible way to build community.
This program has helped me understand that I am a strong person and I do have skills and I am capable of being a really great child life specialist, but sometimes the scenarios that I go through are just really hard. Having that resource available to team members, to staff, to employees is just invaluable.
Yeah.
I'd like to turn to Don. As we learn more about how our environments affect us, whether it's in healthcare settings or work or school or home, as an architect and an advocate of the importance of beauty, how do you approach the concept of beauty in architecture, blending philosophy with science? And what are the biggest misconceptions architects face when they're trying to integrate beauty into design?
Beauty has been a banned word in architecture for a long time, basically since World War I. And the notion that beauty is in the eye of the beholder, so every individual has their own specific concepts for beauty. Neuroscience has really pushed that aside a little bit, and what we say now is beauty is in the brain of the beholder. And it's actually a balance between those two statements. There's acquired beauty and there's inherited beauty. And the inherited beauty comes from our evolutionary history through 60 million years of the humankind evolving. And so there were patterns that recurred over and over and over, and it ended up being included in our DNA. When a child is born, the first action of the child is to open their eyes and look for a certain pattern. And if they can't find it, they're not going to survive. So this pattern is known as bilateral symmetry. It's part of three pattern types that occurred through evolutionary history. Biomorphic, which are curvatures and angles from human body primarily. Biophilic, which Dr. Edwards talked about. So those are patterns from nature. And then bilateral symmetry, which is the facial pattern. And the facial pattern is recognized over and over. I mean, we're looking for it all the time, and we use it in our architecture as when we place elements in a building. I think one of the reasons that there's burnout in the healthcare profession is because architects have moved away from those essential patterns that are common to us all, because we process them efficiently and without stress. And we've moved into an asymmetrical, stress-inducing pattern system that is actually creating environments for the doctors that is not nurturing them. It's actually their autonomic nervous system is on overload 24/7. There's no place for them to recover. And what we've found as architects, I'm sorry, going on and on here, but what we've found as architects is that an environment should be 80% rest and relaxation and 20% curiosity and excitement. And when you have that balance, it's called homeostasis. That's when your nervous system is working properly. It's not stressed, or you're not too relaxed and you can't really function properly. So we're looking at, beauty being inherited and trying to nurture those patterns that support human biology so that we can create homeostasis.
What I'd like to do now is we'll turn it over to all of you with your questions. So there is a microphone where you're seated, and if you just press that panel in front of you when I recognize you, then we will hear you. So you'll just raise your hand if you'd like to, and please feel free to direct your question to a specific panelist, all of them, however you prefer. Questions? There's a lot here, so I know you must have some questions. Back here, okay.
Hi, thank you so much. This was really fantastic, and congratulations for Denver Arts Week. This is really just a wonderful time. My name's Sarah Mia. I am a pediatric radiologist and the chief of radiology at the Children's Hospital here. And I am just so thrilled. This is also happening during our art and medicine elective for our medical students. And so there are many medical students here. And my question to hopefully the panelists and to those in the room, as we have people entering the journey of medical school and medical care, what would be the advice that this panel would give to the future of medicine?
Well, there needs to be more emphasis on creating environments that nurture rest and relaxation. You're under incredible stress as a doctor, and that's recognized, but that stress shouldn't down into your subconscious and autonomic nervous system. Hospitals used to be beautiful back in the 1800s. Look at some of the hospitals, the biomorphic forms they used, lots of sunlight, openness to the outside. Now you're frequently working in environments that have no access to no sunlight, so you're no biomorphic forms. It's all hard-edged, angular materials that don't support proper neurological processing. And so it's 2-3 strikes against you. So the stress that you're under as a medical professional, finding these spaces to help counteract that.
Well, first, Sarah, thanks for coming. It's good to see you. I think it's a really important question, and I'm going to answer with a pretty big answer. I actually think medical education is going to need to change dramatically. Is not a strong enough word in the next few years. I think there are a lot of tasks that we were taught to do that computers can do a much better job of. And I think people worry that radiologists are going to lose their job. I don't worry about that at all. I think what's going to happen is that dissociation between I thought the job was this and it's actually this is going to be able to shift back to allowing people to do more things with the patients and do more humanistic things. Sit there and actually talk to your patient for a while, because you don't need to document everything anymore. So actually, and therefore, the way we educate people is going to have to change dramatically.
I would also add that adding an appreciation of the art in medical education can actually help with creativity of whoever is actually giving the care. And there is hope that some medical education programs are already doing that and encouraging, narrative medicine, encouraging, students to actually appreciate, visual arts and other forms of art. So I think it's coming. I agree with you. It has a long way to go, but I think there is an understanding that much more work is needed.
Hi, my name's Kim Leversage. I'm a retired pediatrician. Used to work here in Aurora in the ER. And I have a daughter who's in medical school, third-year med student. She had her first loss the other day, and the doctor did stop, and they had a debriefing afterwards. So they are making efforts. And just to say that I do feel like the medical system right now is already showing significant changes
from when we went through it. I trained at Emory at Grady, which is kind of the yeah, it's kind of the armpit of the world. And it was a very high trauma intense situation. And I went out into practice with a whole lot of information. But I did find in my practice that there was something missing in the medicine I was taught. And it comes back to what you were saying about the natural aspect and the talking and the including arts. And I took a health coaching, I got another certification in health coaching, and it shows the balance of bringing the arts into treating people. And I treated children with chronic migraines, chronic abdominal pain, chronic problems that our current medical system with all the technological advances has no ability to fix. It's the humanistic approach. And the arts were a big part of fixing those problems that beleaguer our younger generation as well as our older generation.
Well, our time is just about up, so I know we would probably have lots more questions, and thank you for coming. Sure, one more. All right, we got a minute back. Any questions? How on this side?
There's one person.
It caught my attention when you mentioned there's beauty is in the eye of the brain of the beholder. And I do know what you mean. You're talking about heritability, really. Heritability, with that we're attracted to things that, and we find beautiful things that will enhance survival of us or our reproductive efforts. But the other part you mentioned, you said there's two parts, and I'd like you to go into the other part a bit more about conditioning, or what did you call it? Acquired. Could you please?
As you're going through life, you acquire what supports pleasure and also supports your survival reactions. So, and that's unique to your life. I mean, that's what creates your personality. So, and it's, again, I believe there's those two components, inherited beauty. So it's all common to all human beings. So every human being is looking for a facial pattern when they're born. They're looking for patterns in nature. That's everybody, everywhere. And the biomorphic forms. So that's part of the inherited beauty. But acquired is your life and how you assemble the patterns that make up your personality and the way your brain processes the world. So there's this constant push and pull between your emotions internally, subconsciously, and then your frontal lobes. Also. So top-down versus bottom-up processing. It's that discussion that goes on internally. Should I do this? Should I do that? An example I use in my lecture a lot is, I'm sure each of you have said, I don't feel like going there anymore. I can't put it into terms, but I just don't feel like going there. Or you can flip it over. I love going there. I can't describe it. I just love it. Well, that's your subconscious nervous system telling you you're either safe or you're not. And you don't know why. Your brain might try to process it and then figure out why, but it comes first from your emotions internally.
Well, about conditioning. Is that as powerful as the survival part? Or what would you say?
Well, survival, they say, is 5 to 7 times stronger.
Oh, sure.
Then, I mean, that our brains are looking out for us, our safety all the time. So, and if we're not safe, if we don't feel safe, then it usually, takes action. The emotion becomes a feeling, and you start acting on it. I'm going to leave, or I'm going to cover up that sound, or I'm going to mitigate that smell. So that's part of the conditioning that you've grown up with, and your brain has been tuned to your environment and the set of patterns that you've encountered. But it's also, I say, that you're born with patterns that are inherited. And what Anjan Chatterjee says, our brains are more similar than they're different. So we're all born with a very similar kind of architecture of the brain, and then we tune the neurological circuits as we go through life. And
Now we're going to close our program, and Dan Sprick, who asked those good questions, is an artist, and he needs to go now because he's leading the tour over the Benson Hotel collection, which starts in 15 minutes. And now Dr. Wynia will close and tell you more about the schedule coming up.
So much. Yes, so first round of applause. Acknowledge Gabby earlier because she was out handing out lunches and doing everything else. Thank you, Gabby, for all the work you've done. I want to encourage you to stay tuned to future Flourishing programs today and the rest of the week, but specifically today, for those of you who have reservations for tours of the Benson Hotel Art Collection, which sadly are sold out. So if you do not have a reservation, you are out of luck. But if you do, they start promptly at 1:15. The Benson Hotel is directly across, you can see it from outside the doors on this side of the building. It's straight across the parking lots there. Those will be led by artist Dan Sprick and Stephanie Hartshorn, whose works are in the hotel collection and at Gallery 1261, which we'll be visiting tonight. There's also an event that starts at 3 p.m. at the Denver Art Museum. You'll hear more there about NeuroArts from Dr. Edwards, as well as learning about the importance of creative arts therapy with Catherine Reed. That is in the Sharp Auditorium at the Denver Art Museum. The doors open at 2:30. The program starts straight at 3 o'clock. There should be, there's information about the live stream. So if you can't make it in person, there is a live stream to the events at the Denver Art Museum. And then today we will close with a first of its kind gathering of the arts and science communities at Gallery 1261. That's from 5 to 7 tonight. We'll have cocktails and Cuban fare, beautiful works of art, including a special artwork experience of the works by Anne Gargotto, Stephanie Hartshorn, and Andrea Kemp. Sadly, this is also sold out. So if you don't already have a reservation, you are missing out on the Cuban fare and cocktails with me and Emmeline. We'll be there for sure. All right. Do not miss the closing finale, which will also be held in the Sharp Auditorium next Sunday, November 16th, from 2 to 3:30. Guided by fine artist and flourishing advisor Jane Hunt, dancers from the Colorado Ballet Studio will interpret the works of Kang Ho, Dan Sprick, and Jane in an interactive audience experience. That is not yet sold out. So you can still make reservations for this event next Sunday. They're at the Windows to the Divine website, and it will also be available live. So that's the registration link there, and there will be a live stream of that as well. Thank you so much for being here today. Really appreciate it, and hope we see you next time.